social worker and doctor of behavioral health. My specialty areas are forensic social work and integrative health care. My background ranges from working with individuals who have severe and persistent mental illnesses to those with mild to moderate forms of depression. And I just hope that by being a part of this panel that there's some information that I can share with those who may be experiencing challenges with mental wellness throughout this pandemic. And I thank you, Dr. Lagarde and Dr. B, for inviting me to be a part of this panel.
Thank you. And Dr. Lagarde-May?
I'm Dr. Lagarde-May. I'm currently practicing in New Orleans, Louisiana. I'm a family medicine physician, graduate of Xavier University and University of Kansas Medical Center. And currently I'm seeing newborns to geriatrics.
Thank you. And Keishia, Nurse McCoy?
All right. My name is Keishia H. I'm a nurse practitioner of 9 years. I practice primary care and I also do urgent care. I see a range of 1 to geriatric, and that's it. And I practice in New Orleans.
Thank you. And Dr. Pierre?
I am Dr. Nakeisha Pierre, Xavier Prep class of 1994. Xavier University, 1998. You know, those dates, they all run together. So I am a cardiovascular anesthesiologist. I am the director of cardiac anesthesia at Tulane and also the director of preoperative medicine at Tulane. So as an anesthesiologist, my subspecialty certainly is cardiac, but I do everything from cardiac cases to liver transplants, take care of pregnant mothers. So really, really busy practice at Tulane, both downtown and at Lakeside. And so I am super excited to be a part of this. I consider myself the COVID police at Tulane. When they see me coming, they all pull their mask up. And so I am definitely a physician champion for this cause, and so super excited to be able to make sure we are disseminating the right information to our babies as they go out into the world. So thanks for the invite.
Thank you. Thank you all so much again for being here. So I'll jump right into the questions. So the first question I have, so I've read many articles on this, especially the ones that have popped up in the last couple of weeks. Like some articles have said, wow, campuses have made the decisions to return. Like some researchers have said, like, that is not a good decision. Like, is it feasible that college students are going to be able to social distance? And do you think that students are just going to be able to be safe, social distancing? Is that a good move? Like, I don't even know if that question even makes sense.
It does. This is Dr. Pierre. I'll jump right in there. I think that schools, they are going to have to rethink the classrooms. They are going to have to rethink living arrangements. So they absolutely cannot go back to their traditional setup where you have 30 kids in the classroom, and even the setup in the dormitories where you have a roommate. It's impossible for you to be able to execute social distancing, and that is going to be key and critical. So not only do I recommend that our students, they maintain masks and also eyewear, because this virus, it not only spreads through inhalation through your mouth and your nose, but it also, it can be contaminated through your eyes. So we need to have our eyes protected. And the only way that these schools are going to be able to execute that, again, decrease the classroom sizes, so they're going to have to rethink their model, whether you have some students that enroll via Zoom and then you have some that actually have a physical presence. And then I know at Xavier University, my daughter's a rising sophomore there, they are setting up arrangements where there are no roommates. So it's only one student per dorm, and then they are securing contracts with local hotels to be able to accommodate all the students. So I think unless schools are being meaningful and actionable in that way to make sure that our students actually can maintain the 6 feet of distance, then they're putting themselves at risk. And this is not going away. We don't have a cure. We don't have a vaccine. And so until we have those things in hand, we need to conduct ourselves the way that we did when we initially went into isolation, because nothing is different.
And to piggyback off for Dr. Pierre, every university will be different. Every college, every university, we're all in different cities. So depending on what state you're in, we all may be in different phases. Right now, we're in phase 2. Somebody else might be in phase 3. Somebody else might be in phase 1. So I would say, you know, first, the university, like Dr. Pierre was saying, needs to have a session or orientation all over again, like we did freshman orientation with the students, because things will be different. This is a new normal. Nothing is the same. Classroom settings are different. Dormitories are different, like she said. Definitely check with the local health department as well, because the local health department controls what that city is doing, which is getting information from the state level and the federal level. So depending on where you are geographically, it may be different. So like your daughter, Dr. Baham, Catherine, is at Spelman. You know, her friend might be in Tennessee. You know, another friend might be in California. Each university may be functioning differently. So I think each university, the administrators from the top down, need to meet with all students upon coming back to campus, because it's not going to be the same. And I'm glad Xavier, you know, has stepped up and is doing the single dorm living. That's key, you know, because there's still a lot of asymptomatic carriers, especially in that population. So, you know, college life will be different this year.
Yeah. So for parents, you know, when I think of like what I should be sending her back to school with, like, am I loading up on hand sanitizer, mask at this point, eye coverings, like, you know, what am
All of
I?
the above.
Yeah.
Yeah,
Right.
yeah.
All of the above: hand sanitizer, disinfectant wipes, bathroom items. You know, I don't know what their bathrooms. Some people still have the traditional, what do you call it? Like the unified bathroom. It's not separate, you know, so they have to keep in mind all of that. And the 6 feet rule is still in place. So a lot will be different. You know, it might be limited. How many go here? How many go into the eating areas? But I would load up your college student with everything initially. You know, of course, they're going to have to restock, but load them up with everything that you will use here. Like if they were home with you, load them up. You know, eyewear, mask, several, you know, because they should be washed, several masks, soap, disinfectant wipes, hand sanitizer, you know, everything that she would be using here.
Yeah, yeah, it's so much to think about, and it's so overwhelming. What
Something that I
about?
want to emphasize. This is something that I want to emphasize. While, as Michelle mentioned, there are definitely going to be our children geographically, there'll be different things that are being mandated in different areas in terms of the phases. But I would encourage everyone to make a very personal choice to remain in phase 1, again, because nothing is different. There are a predominance of asymptomatic carriers that are our super spreaders. That's just out there. And so, you know, looking at the person to determine whether or not, hey, they're coughing or whether they look febrile, that unfortunately, it's almost futile. Not really, but it's almost futile, because you can have a person standing right next to you that's asymptomatic, that's COVID positive. So I think that, again, unless we have a cure or a vaccine in hand, remain vigilant with mask, eye protection and strict hand washing. And so I would not follow the lead. And I think that's the problem with the community right now is they think, okay, we're moving through these phases. And so things are getting better. This virus has gone away. It hasn't gone away. The numbers have ramped down because we've been vigilant and we've been distancing and we've been masked and we've been hand washing. But if we resume our normal behavior, we are going to see the numbers ramp back up as we are observing nationally and even internationally. So I would say, again, make a personal choice. That is the safest thing. Make a personal choice to remain vigilant. Send your children with masks. Send your children with eye protection and plenty of disinfectants. And maintain that, again, until we have a vaccine in hand.
Yeah, okay. So what if a student does feel sick? You know, I can just imagine like the health services, you know, they may be overwhelmed at some point. Like what should be the first course of action for the student who feels sick? Like, do they go to student health services or should they immediately go to an urgent care facility? Should they immediately call mom and then she freaks out?
I would hope Michelle mentioned that in orientation that they have some process set up for the students. I would certainly hope that if they think that a student is, you know, symptomatic and displaying symptoms of COVID, that they aren't encouraging them to, hey, go to the student center where people are probably not likely to have N95 masks. So I would think that the first call should be to the student health services. And again, I hope that there is some sort of orientation that lays out, you know, a policy or procedure that the students should follow if they think that they're sick. But I would say start with the campus services first. I'm hoping that there's something in place for the students.
Okay.
And now that we have a lot of telemedicine that students can do, you know, having that set up and make sure their phone is capable so they're not running to the urgent care where they're, you know, prone to become in contact with the virus, that they can do it from the, you know, from home.
Yes.
Have a visit from home. And they even have the kits where they can have the thermometer and everything. You can order them from your insurance company, and that also is helpful.
Yes.
And I also think it's good to have a conversation with them, not only about their physical health, but also their mental health, asking them how they're feeling. You know, their lives were abruptly uprooted. You know, they were separated from friends and colleagues, their dorm rooms, just everyday life as a college student. There has been an influx of anxiety and depression just due to the elements of the unknown. So I think having an honest conversation with your child about, you know, how are you feeling, what's going on, and then also reaching out to student support services, again, as Keishia mentioned, for telehealth visits, because a lot of clinics also offer telehealth visits now. So even if they can't get it through the school, you know, if they're still linked to your insurance as a parent, or if they have their own independent insurance, they can more than likely get a telehealth appointment to meet with a mental health provider who can kind of process with them these feelings of anxiousness and feeling down just due to the uncertainty regarding the pandemic and what life is going to look like for them beginning in the fall.
Yeah.
And also they might want to, which we tell a lot of my patients locally, you might want to call ahead to your student center, you know, student health center, to see what their advice is, you know, because if you think you may have symptoms of COVID, they might want to prepare ahead of time that you're coming in there to isolate you when you arrive, you know, because other students are in there, you know, some healthy, some not so healthy. So they may even direct you to a local ER or urgent care. I don't know if the universities will have the testing supplies to even test for COVID. So instead of coming into the student center, you know, they may direct you to, like Keishia and Dr. Johnson was saying, like a telemedicine or your local community medical center, you know, that's doing testing, or the ER, you know, depending on what your symptoms are. because you may not be able to do student health, you know, that's limited. You might need an ER, you know, for more urgent or intensive care, you know. So the universities, they have the rapid COVID test. They may not have that, you know, and if you're really symptomatic, you want to know. And I'm sure the nurse practitioner or the physician would want to isolate you. So definitely call ahead, but use them first. You know, they're on campus. A lot of students are away from home. They might not know a local physician or a local health center, but your student health center may. You know, where I am, we're close, we're on Dillard's campus. So a lot of times we work very close with the nurse practitioner at Dillard. So she'll refer a lot of students to us, you know, if they can't handle anything over there, because we know what's in the community, you know, the testing locations, which ER might be backed up, you know, where you can get in faster, which urgent care should you go to. So, but definitely check with them first. You know, that's always first. Call ahead, wear your mask, you know, like Dr. Nakeisha was saying.
Yeah. Yeah.
Don't scare your parents.
Right? I'd like to hear from each of you, because so I know, like, of course, like this has been a devastating year for the class of 2020. Like, they lost graduation. But as my daughter also emphasized, like, it has also been a devastating year for college freshmen who like missed out on the full year of like the first year college experience. So of course they are anxious to get back to college campuses, experiencing, you know, those campus activities. I don't know if you've seen in the news just this week and last week about the LSU party and the 300 cases or whatever from the LSU party, and then the Newman party, and then there was some party in Texas, cases from that. What would your advice be? And I know Dr. Pierre, you said like urging people to stay in the phase one setting, but like what would your advice be to the college student who is perhaps going back to campus in the fall? But what would your advice be to that student to not like be so anxious to get back to sanctioned, non-sanctioned campus activities, because we are still very much in the middle of this pandemic?
Right. I'm glad you're addressing this because I think it's difficult for the students. And I think, you know, we've already mentioned on this call the mental aspect of it. It's very difficult for them because there are a lot of things that have not met their expectations this year. But it's not time for norm. You know, we're not quite at the place where those normal expectations of freshman year and that college experience, it is just not pairing with reality right now. That's just not where we are. We will, I think, in a year. I truly think this next upcoming academic year, I think that we are still going to have to proceed with precautions. And I anticipate the year after that will be a normal experience for our students. But it's important for them to understand that this virus is not discriminating. You know, we initially thought, you know, children were immune from it. We initially thought the young and healthy were immune from it. It is not discriminating. I have personally cared for and watched very young and healthy people deteriorate and die from this virus. And so it skips and spares no one. And that's important for them to realize that it's just, these are all personal choices that we're making, and they really need to consider whether that party or, you know, whether hanging out with this new guy or girl, you know, whether that is worth a potential life-threatening, you know, health concern. And that's the way that they need to approach this, at least for now, because that's where we are. And, I think our young kids, they feel invincible, because they are young and healthy. They may not have someone close to them or someone personally that they know have succumbed from this virus, but it is happening. It is happening every day. It is happening to children. It is happening to teens and young, healthy adults and the old alike. And so they need to be aware of that they're not immune from the deadly effects of this virus.
Thank you.
Yeah, and piggybacking off of her, I would just tell all college students, don't go back expecting, like she said, a normal college experience. It's not going to be normal. Don't go back expecting the large gatherings. And every university and college should have that talk with their students. Now is not the time. Though we're progressing, stay in the phase 1 mentality, just like Dr. Pierre said. It's still out there. And I'm sure these students, LSU, Newman, they went to the parties very healthy, no symptoms, feeling good. This was going to be a nice social gathering. Everybody pretty much knows everybody, but somebody at the party was not okay. That's the asymptomatic carriers that we're referring to. So that one individual or two individuals got an entire student body or party, multiple people at the party ill, not on purpose, but they may not have known that they had the virus. And that is the scary part. That's the part where you have to stay in phase 1 mentality, though your city may be progressing. So if you don't have to go out, don't go out. Go and get your basic necessities, your food. If you have to go to the doctor, you can go out, but don't expect the parties. Don't expect, a loaded gym for a basketball game. Don't expect to hang out on the yard. Just little things, stay in that phase 1 mentality like we did when we first shut down the cities. Go out when you need to, get what you need, wear your mask, use your hand sanitizer, wash your hands, and come home. Study groups, all the little things, I wouldn't really do big study groups. I mean, if you study with someone, 6 feet apart, you have to keep that 6 feet, mentality in mind. Little things.
And there are ways to socialize safely. One of the things that I encourage my daughter to do, I said, you can meet with friends, you guys, you can drive your car to a park. I would say open spaces would be the best thing. Hey, you guys, line your cars up. Everybody stay on their car, distance yourselves, and you can socialize in that way. Or, at a park, hey, sit in a circle, 6 feet apart. You can socialize in that way. So there are ways for them to safely socialize, but just being in that close contact, that they want and desire, it's not quite time for that. And again, we will get back to that point. We will. I truly and sincerely believe that we are going to move forward, that we'll come up with a vaccination that allows us to return to what we view as our normal. So it's coming. So they just need to be patient. They need to be patient and in the interim, just remain vigilant and remain safe. And, and piggybacking off of the study groups, just being mindful that, if you are in an enclosed space, if you're in an enclosed space, a small area, just really try to limit those groups. Even though you're 6 feet apart, if you have a COVID positive patient or COVID positive person, that's in that room, that's in that enclosed space, just remember that if that person is not masked, that they are potentially aerosolizing COVID virus. So just I would say the safest thing, if you're going to gather in groups, it's best to do it in an outdoor and open area or some place that's really well aerated.
Yeah, that's a good idea. Masks are a must, and because things are not going to be the same, a lot of people should seek out, and I'm looking at Dr. Johnson, seek out their mental health specialists. It's important. A lot of people forget about that aspect of health, but it's so important, especially for a college student trying to study and progress themselves, and you have exams and you're just adjusting to this new normal. Seek out your camp counselors, or If there are no camp counselors, seek out a local counselor, a therapist, you know, talk about it. And I'm sure Dr. Johnson has more, you know, she can add, but mental health is important.
And as Dr. Lagarde mentioned, and I also want to put an emphasis on those students that may not be returning to campus, there are a lot of online programs, and some kids just may elect to not live on campus and decide to stay at home. And so what can assist them with managing that mood instability or those depression and anxiety symptoms is to develop a routine. And so even though you are at home, even though you may be taking online courses, you can still have a routine where you wake up at the same time every day, where you log on to your courses at a certain time, where you designate a certain time of day to follow up with emails or your professor and things of that nature. Because what a schedule does is it gives you a sense of accountability, and it also gives you something to look forward to, and it makes you feel productive. And when you're feeling productive and when you feel like you're doing something that's valuable, it elevates your mood and it also helps you to feel better. One of the other things that Dr. Lagarde mentioned is reaching out to a mental health professional, whether it be on campus or someone near to the campus. And even though I know that a lot of people still may have those feelings towards a stigma and related to mental wellness, you know, what I tell all new patients since this pandemic has occurred is that we are all experiencing something that we've never experienced before. And so there is no playbook on how to manage anxiety and depression during a pandemic. And so one of the best things that you can do is when you feel like those feelings of being down, feeling on edge, excessively worrying, are starting to cause impairment in different areas of your life, it is always good to reach out to a mental health professional to kind of process some of these things. You know, it's good to have that natural support like a best friend or a colleague or a mom that you can go to, but mental health professionals have a certain skill set where they can teach you different coping skills based on tools you already have to kind of help you do these difficult times. And so I just can't express enough how just having a mental wellness check-in, you know, would do you some good, especially during the pandemic that we're experiencing.
As a mom, I have two sons that graduated. One graduated from college and one graduated from high school this year. So it was trying times for them mentally. You know, the oldest that graduated from peer review, he was set up for all his tryouts for football and to go to the NFL. And when COVID-19 happened, that all came to an all, like he couldn't do it. So he didn't know what was his next step in life. So it was like trying, like Dr. Johnson said, it was trying to get him mentally prepared, like, you know, we might have to, do other options as far as COVID-19. So he started like, well, why this had to happen? You know, you have to sit down and explain this. But some people don't have that parent that's in the medical field or have people to talk to. So I just encourage parents to get someone or make sure that they have that medical part, that they have someone to talk, their kids have someone to talk to as far as mental awareness, because it is real.
And Keisha, one of the things that I heard you mention was his expressing, why did this happen? And so when you look at the abrupt change that it caused in all of our lives, it does feel similar to a loss. And so when we experience loss, we may bargain, we may go through an acceptance phase, we may go through a phase of being angry, we may go through a phase of denial. And those are 4 of the 5 stages that you go through when you're experiencing grief loss. And so someone experiencing those emotions, especially with tryouts and things that he had set up, it's normal for him to feel like that. You know, but I always encourage people, you know, process whatever you need to process. So if you feel angry. If you're upset, be upset. If you need to cry, cry. But once you've done that, if you still feel like you're not okay, reach out to someone that you trust. And if that person can help, meet with a mental health professional that can kind of help you to look at whatever other options that you may have. But I did want to point out that, you know, because everyone's lives changed so drastically, that it very well can feel like a loss, because it's a life that we were living one day. And I know the exact date for me was March 13th, when I was told that my son would no longer be going to school. And so just that abrupt change, and what do we do next? And so it can feel like that. So just being okay with processing those emotions will help. a lot of time those feelings can feel prolonged when we try to bottle them up. And we say, I'm not going to worry about this no more. I'm not going to cry over this no more. I'm not going to let this pandemic get to me. And the thing that happens is when we internalize those emotions, they still have to go someplace. And a lot of times when we don't talk about it, it can manifest itself into physical health symptoms, you know, headache, issues with your heart, stomach ache, and things of that nature. And so it's always good to talk about it, see what other options you have available, and it can definitely help with just processing those emotions.
Yeah, I'm so glad that that was stressed, because I know, you know, with the abruptness that happened, a lot of colleges just presented a pass fail option. So we know that students are going through a lot, you know, we'll give them the pass fail option. So if they don't do well this semester, it doesn't affect their GPA. Well, we don't know if schools are going to do that next semester. It's like, okay, well, now we've been living with this for a minute, so you should just like magically know how to handle it, right? So I'm just like so glad that like y'all have brought that up so that parents know and students know like this is a real thing. Like students need to be able to talk to someone about what they are going through and to be able to just process their feelings so that they can, you know, just have someone to talk to and be able to release that and hopefully focus on their work to continue their work for the semester.
And I would just do a check-in, like Dr. Johnson said, do a check-in on your friend, even if that friend looks okay. A lot of us can function and we're not okay. But, you know, I think Dr. Johnson said, you know, the stigma for I need to talk to a counselor, I need to talk to a therapist is still there. So even if your friend or your classmate looks 100% normal on the surface, still do that check-in, because you never know what's going on the inside, you know, and it may be subtle things. This might be a straight A student and grades may start to fall, or he or she may miss class, you know, clothing may be disheveled, or, you know, I had a patient today just say, you know, she's sleeping a lot more than usual. Little signs, you know, it's not always I'm crying a lot, I feel depressed, you know, I stopped eating. It might be little signs. This might be a very energetic, outgoing person and they start to withdraw. So little signs that those mental health checkup, and social media is everywhere. That's one thing. And, you know, I'm sure, I'm not saying ages on this call, but I'm sure a lot of us went to school around the same time. And, you know, I can speak for Nakeisha and I, because we went to high school and college together. We didn't have social media. You know, I can remember at Xavier doing my first email address. You know, like there are very easy ways you can check in with someone now. You know, if you don't want to call them on the phone, there's Instagram, there's Facebook, there's texting. It's so much stuff now, you know, but just look beyond the surface. It's not always going to show up on the outside.
Yeah, and one thing that Dr. B mentioned was the ability to focus and concentrate. And a lot of universities have a support center. And so if that challenge with focusing and concentrating and being able to pay attention to schoolwork has become so debilitating that it's impacting the performance, students can get accommodation for mental health issues like a diagnosis of depression or a diagnosis of anxiety. And so if that means they have extra testing time, if that means they get to turn in assignments at a later date, whatever that additional support is that they need, as long as they have the appropriate documentation from a mental health or medical professional, they can get it for whether it's long-term or short-term accommodations to kind of help them. And so that's also an option if this person wants to remain enrolled in school, but their symptoms may be escalating.
Thank you. Thank you. I don't think that a lot of people know that. Yeah, thank you very much. We're coming to the end. One final question before I just ask you your final thoughts. What are myths that are still floating around. So I think the one about Black people can't get the virus, I think that one is pretty much dispelled. But what are myths that you are still seeing or hearing going
The
around?
face masks. Face masks aren't important. The face masks, they're not so much important. You may not have the virus, or you may think you don't have the virus, but it's important for I keep saying the asymptomatic carriers. You know, you might not know. So you wearing a face mask is protecting everyone else. And if everyone wears a face mask, everyone is protected. So that is so important. No, you may not be sick, you know, you may not have COVID, you're not coughing, but what if you have it? It's always the what if, you know, so you wearing a face mask is helping all your other classmates and your administrators and your teachers stay protected. And if, like I said, if all of you guys wear a mask, then everyone is protected. So I think that's the biggest myth, that masks aren't important. One of the biggest myths.
Thank you. Any
And
other?
another myth that is a virus. It's not a bacteria, so we cannot treat it with antibiotics. You know, we have patients calling and asking, well, can I just get an antibiotic? No, antibiotics is not going to cure this. It is a virus. So, you know, it has to be treated symptomatically, but it can cause some complications that can cause a bacterial infection in the body, but it starts off as a virus. So an antibiotic is not going to cure it.
Wow. Okay. Thank you. I hadn't heard that.
And I think I alluded to this earlier. It's just, you know, as we progress, as communities progress through the phases, it's just important that they understand that nothing has changed in terms of this virus. It is still present, it is still prevalent, there's no cure, there's no vaccine. And so that is unchanging. And so don't equate that, you know, hey, things are getting better and the virus is gone and it's been eradicated. As we move through the phases, it's important that people understand that it's still here and present, that all that us progressing through the phases means is that the numbers are ramping down in a community, and it's ramping down in those communities that are remaining vigilant, that are wearing a face mask, and that are distancing themselves. The greatest form of transmission is through this large particulate matter. So when you talk, you aerosolize. When you breathe, you aerosolize. So it's not just the person that's sneezing and not just the person that's coughing. Simple things like talking and breathing. If someone is COVID positive, they're aerosolizing the virus. And so that's where masks come in. It, for the most part, no, it's not an N95 mask, but it is protecting most individuals from spreading those large particulate droplets. And so again, it's a part of our social responsibility. You're protecting yourself, but you're also protecting other people that may be more vulnerable.
Okay, any final thoughts before we wrap up?
I just have two numbers that I would like to share. So the first number is to the National Suicide Prevention Line. And so if someone is feeling in distress and they begin to have thoughts of harm to themselves, they can call 1-800-273-TALK. The number is 1-800-273-TALK, and they can be linked to a crisis counselor that can help them through that situation. And then I know we live in an age of text messaging where a lot of people utilize text. And so if someone is in distress, they can also text the word START, S-T-A-R-T, START, S-T-A-R-T, to 741-741 to reach out to someone via text message if they're more comfortable, you know, via text message than through a phone call.
Okay. And give me the number again for START.
741-741.
Thank you. Thank you. Well, ladies, thank you all so much for joining me this evening. This was an absolutely amazing talk. You all provided instrumental information that I know definitely my crew of first year college moms will definitely appreciate. And everyone, we had a few people on tonight that were actually watching this Facebook Live, and those that will watch the recording later on, they are definitely going to appreciate your words of wisdom. So thank you so much again for joining me. And you all have a very good evening.
You too.
Thank you. Honor